Welcome to Tuesdays for Nurture. I am your host, Reverend Dr. Chris Davies, and I am delighted to be here with you on this day. Tuesdays for Nurture are the occasional Tuesday webinars in this series where we faithfully focus on education for the people of God. Topics from faith-filled politics to how-tos in congregational life to the impacts of current realities on the life of the church will be featured. Each webinar will include clear suggestions on what you can do to change the church and the world towards the world God imagines for us. Tuesdays for Nurture happens occasionally over these next coming weeks and months and are pulled together by various leaders across and beyond the United Church of Christ. Hosting conversation today is Reverend Mike Schudemeyer. Mike, I am delighted to welcome you, and I am so excited to be here alongside you in this work. Thank you for all that you've done and for all I know you will bring in the wisdom of people present with us today.
Thank you, Chris, for all your good work as well. And hello, everyone. Thank you for joining us today for this conversation, LGBTQ plus pastoral care, justice, and COVID-19. The context of today's conversation is the International Day Against Homophobia, Transphobia, and Biphobia, which is observed on Sunday, May the 17th, which also happens to be the UCC's Mental Health Sunday. This webinar is being recorded and will be available on YouTube afterwards, and a link to the playlist will be sent to you all in a follow-up email. So I want to begin today with a bit of history. In 1987, the 16th General Synod of the United Church of Christ adopted a pronouncement, Health and Wholeness in the Midst of a Pandemic. It opened with the words, "Through the centuries, Christians have carried a vision of wholeness for the world, recognizing that God created the world in love and that in Jesus the Christ, God redeemed the world. As followers of Jesus, we are called to embody that love in the midst of a pandemic of catastrophic proportions." That's how that pronouncement began. It went on to say that the ministry of healing is about, first, the ministry of compassion, and second, that the church seeks all possible information and medical skills for the prevention and healing of disease. It asks medical institutions, foundations, and government agencies to engage in research to overcome ignorance and superstition and to help those who suffer. And third, as in all healing, the church seeks to involve people in their own prevention and healing. And fourth, towards the end of Jesus' life, he commissioned his disciples to preach, to teach, and heal in his name. He told them that they were his hands and feet, the embodiment of God's love for the world. We who accept the call to embody God's love in our time, like Jesus, will walk and talk with the ill and their families, will confront the narrow prejudices that have caused society to isolate and judge, and we will carry the vision of wholeness that we know through the life, death, and resurrection of Christ. By the power of the Holy Spirit, we will carry the good news that in Christ, God has redeemed all creation. And fifth, the church commends those who, at cost and risk to themselves, engage in ministries of healing. So many people are engaged in healing at this time, as we know from the data that as of today, there are 4,314,114 worldwide cases. And in the United States, there's 1,395,490 cases of coronavirus. We know that there have been so many deaths, 291,164 globally, and 82,690 of those have been in the United States. Just at the end of April, the UN put out a report called "We Are All in This Together." And it said, the COVID-19 crisis has exacerbated the vulnerability of the least protected in society. It is highlighting deep economic and social inequalities and inadequate health and social protection systems that require urgent attention as part of the public health response. Women and men, children, youth and older persons, refugees and migrants, the poor, people with disabilities, persons in detention, minorities, LGBTI people, among others, are all being affected differently. We have an obligation to ensure everyone is protected and included in the response to this crisis. So today, as we consider LGBTQ pastoral care, justice, and COVID-19, some of the key issues that we want to touch on today include stigma, discrimination, isolation, and the experience of depression and mental health, immigration, access to healthcare and human rights, data collection, generational issues, such as youth sheltering in home environments that are actively homophobic. No webinar can adequately represent the spectrum of identities within and beyond LGBTQ plus communities, and this is true today as well. Later in the webinar and the follow-up email, we will share information in upcoming webinars where you can hear from other voices of lived experience not present in today's panel. So let me introduce our panel for today, and I'm very excited about them. I first want to introduce to you the Senior Minister and Elder Carmarion D. Anderson. She's a vibrant and visible trans woman of color with a passion for inclusion in the world. She is the Alabama State Director with the Human Rights Campaign. Many of us know them as HRC, under the Project One America initiative, and she became the first trans person of color to serve in a leadership role with HRC in the organization's history. Carmarion was born and raised in Dallas, Texas, with family roots in Mississippi. She worked in public health and education, managing both local and national prevention initiatives, focusing on HIV and AIDS and other health disparities that impact marginalized communities. She is the founder and previous executive director for Black Trans Women, Inc., which is the first national nonprofit organization with a programmatic focus to uplift the voices, hearts, and souls of Black trans women in conjunction with Black Trans Advocacy Coalition. Carmarion brings a wealth of experience in faith spaces, currently serving as the National Co-Minister and South Region Coordinator for the TransSaints Ministry of TFAM, the Fellowship of Affirming Ministries. For 16 years, Carmarion has served as an Associate Minister and Elder at the Living Faith Covenant Church located in Dallas. She's the proud parent of one son and has two adorable grandchildren with the third on the way this June. Welcome, Carmarion. I also want to introduce André de Plessis, who is the Executive Director of ILGA World, the International Lesbian, Gay, Bisexual, Trans, and Intersex Association. ILGA is a world federation of more than 1,600 organizations from 160 countries working for LGBTI equality worldwide. Born in Zambia, André is from South Africa and grew up in the UK and India. Prior to being appointed as executive director, André headed up ILGA's advocacy work at the UN, assisting LGBTI organizations from around the world in the use of the UN system to help bring change in country, and led a challenging and successful civil society campaign to create the position of the UN independent expert on sexual orientation and gender identity. He is a human rights lawyer, also with experience in corporate, financial services, and litigation fields in both London and China. And prior to ILGA, he worked on business and human rights in conflict zones, environmental and trade justice issues, and also supported UN special procedures at the Office of the High Commissioner for Human Rights. He attends the Evangelical Lutheran Church of Geneva in Switzerland and is my colleague as a member of the World Council of Churches Reference Group on Human Sexuality. And thirdly, I want to introduce to you Reverend Rhina Ramos. She is the coordinator of Proyecto, Encuentros, Bienvenida, Gracia, an ordained minister in the United Church of Christ. She has led an open and affirming Spanish-speaking congregation in Oakland, California since 2011. Born in El Salvador, Rhina grew up during the Civil War, and embedded in her heart is the voice of San Romero de las Americas, denouncing oppression from the pulpit. Rhina is also an experienced community organizer that has led programs and campaigns to promote educational equity, labor rights, LGBTQI human rights, international solidarity with El Salvador, and domestic violence prevention. She graduated from Hofstra University Law School in 1995 and received her master's in divinity from the Pacific School of Religion in 2003. So let's get started. So I'd first like to ask this question to our panelists. From your place in the world, what do you see in terms of the impact of COVID-19 on the lives of people with LGBTQ plus identity? And so let's start with Carmarion.
Absolutely. Thank you, Michael. And the UCC family, what an awesome opportunity to participate. I want to say that we may be siblings by another parent since I am with the Fellowship of Affirming Ministries. And so this is an awesome opportunity. I always love to connect with Reverend Mike. At this time, I'm going to share my screen, kind of want to hone in since we're speaking about COVID, but because we are also speaking about the homophobia, transphobia, and all the phobias that, that still exist here in our society, I really want to hone in on a conversation about transphobia. And I am going to share. Perfect. So here we are. So I titled this, We Are Here, Transgender and Gender Nonconforming Communities. Michael has already given my bio, but I am Carmarion D. Anderson, and my required pronouns is she, her, and hers. And as Michael did say earlier, I also belong with the Fellowship of Affirming Ministries. We have a ministry particularly for trans-identified individuals called TransSaints. And I have the privilege to serve as the co-facilitator minister for that national group. So you will see both logos because I'm kind of wearing both hats. It's okay. That comes with the lash and the blush line, I guess, for me, that I'm able to do this. So we're going to really focus on a couple things just really quick. In the short minutes that I have, the church, we say this is a homily, and as always, kind of a word for me that doesn't sit well as a Black Pentecostal preacher. We can go longer than that, but we're going to run through some slides just to give you some context from my personal narrative, from my community, and my involvement working in the trans community. We're going to understand transphobia. We're going to understand the transgender livelihood, and how can you assist. So let's get started. So we always have to start with the basic of what's transphobia, and I'm probably not going to read everything that's on the slides, but transphobia is the fear, hatred, and disbelief or mistrust that people who are transgender and gender nonconforming people thought to be transgender or whose gender expression does not conform to traditional gender roles. Transphobia can prevent transgender gender nonconforming people from living full lives and free from harm. So I wanted to ensure that we see transphobia in various expressions, a strong dislike and prejudice that comes out of this expression, the negative attitudes and beliefs towards this community, unreasonable fear and misunderstanding about this community, and as well bullying, abuse, and even violence, which we see has impacted our trans-identifying GNC community, particularly Black trans women who are still vulnerable to these violence that we see. And every time you turn on the news, my anxiety is that I'm going to see one of my trans or GNC siblings on the news because they've been brutally, killed. And just the discrimination is still very high. Transphobia does continue. It does create subtle and obvious forms of discrimination. In this example, I want to provide you just so you can think on people who are transgender or even just thought to be transgender or trans-identified GNC may be denied jobs, housing, or healthcare just because they are living out their truth. Many people will hold transphobia belief because it's what they have been taught. That is the key word. It's what they've been taught. It's a learned behavior. And we want to make sure that we're in position during this webinar to say, have your own mind. Now I feel like I want to preach now. So have your own mind. And so some people are transphobia because they have misinformation or have no information. And it's our responsibility to go out, get the information that we don't know, check our biases, our explicit biases that we have, to really make sure that we are being inclusive across the board. I always like to say, you never know what comes out of your house until it comes out and come back in. And when they come in, they may not have looked the same, act the same as the way they left out. And so we always should be prepared and educate ourselves. Transphobia harm, the stress of transphobia on transgender and gender nonconforming people can produce harm and can cause depression, anxiety, fear, isolation, feelings of homelessness, loneliness, and high rates. Let me just say suicide, but high rates of suicide. So there are some effects on the trans and GNC community. Good old verbiage here says, while the visibility of transgender and gender nonconforming people is increasing in popular culture and daily life, we still face severe discrimination, stigma, and systematic inequality. We have issues all around as it relates from my previous field in public health, as we call social determinants of health, or just living in this society free and through the lens of equality. And so poverty rates, I just wanted to throw a few statistics out to you. This is coming from an article that was written by the Human Rights Campaign, recently released. And it says that transgender adults, 29% in the US, tower over those other groups for poverty. Black and Latinx spearhead the highest in transgender adults, are more likely to live in poverty than trans people of any other race. We have challenges in employment. The Center for American Progress report 27% of transgender workers report having been fired, not hired, or denied a promotion due to their transgender identity. All of this thus far, discrimination like this leads to increased risk of poverty, economic struggles among those most vulnerable. Consider, we are most vulnerable. We get the short end of the stick. Sometimes we get nothing. And we are a vulnerable community within the LGBTQ community. In addition to that, healthcare, more statistics, 22% of transgender adults and 32% of transgender adults of color have no form of healthcare coverage. You know, that's very, very depressing to me. Not someone, as I like to say, have privilege, but I have access because I have a job with insurance. But we're in this COVID crisis. And if there is no health insurance, you know, to allow access to receive the care that they need, we are still the vulnerable population at higher risk as it relates to the COVID. Transgender women, 29% are most likely to have avoided going to the doctor because of cost. This can all lead to avoidance of medical care, even when medically necessary, and to severe economic hardship when medical care is ultimately accessed. Chronic illness risk. So the Center of Disease Control, which I still love working in my public health hat, 1 in 2 Black transgender women and 1 in 4 Latinx trans women have HIV. Again, we're speaking about vulnerable populations. We're speaking about the severe impact that transphobia, because of lack of education, lack of us being able to show up in our truth, being visible. We have to be at those tables of decisions in order to make an impact, to even reduce transphobia, to start educating a society that we are here. Lack of data collection, I'll just throw this in here. We still need numbers. So it's a circle accountability. Include us, and for my community, show up. As we continue, how do we stop transphobia? Being trans and gender nonconforming is not a choice. Prejudice is. So no one has the right to discriminate against transgender and gender nonconforming or any other person, or to hurt them emotionally or physically. Just a few things that I'll pull out of this, things that you can do. Let transgender and gender nonconforming people in your life and let them know that you are a friend and ally. Be okay to say, I see you, I support you, I believe in you. Give them those positive affirmations. Educate yourself about transgender issues. Don't believe stereotypes about us. Don't make assumptions. Go out and kind of just learn. And when you don't know, be okay. For instance, use gender neutral language. They and them, or folks and people, instead of he and she, or girls and boys, because you may be boxing them in a binary that they don't even represent or no longer comfortable with. As we move forward, there's a wonderful quote that I created well over 10 years ago with the National Black Justice Coalition, and I upgraded my picture because I believe that the Holy Spirit preserves those that worship it. And so I thought that I'll leave you with a souvenir. But the quote simply says, I'm proud to be Black and trans because I was created in God's likeness and for my design purpose. We were created here on earth. We have an assignment, we have a purpose. And I promise you, for my trans-identified and GNC siblings, we have to walk out that purpose. We have to show up to be counted. We have to find social networks, more numbers that we have. For those that are allies and for those I'm trying to recruit as allies, Come and get us. Don't allow us in Ezekiel to remain in our graves, but call us out, help us out, so we can also be part of this society and we can live like I believe that the divine has called us to live, and that's in love. I want to thank you for this opportunity again. My name is Carmarion D. Anderson. I wear many of hats, HRC, Alabama State Director, and with the Fellowship of Affirming Ministries, TransSaints National Co-Facilitator, and South Regional Coordinator. What a pleasure. Thank you, Michael. Back to you.
Thank you, Carmarion. You have given us quite a picture of the kinds of experiences that trans people face. You've challenged us with things to do and a sense of justice, and you've given us some inspiration with your spirit. So thank you so much for that. And so I'm going to turn to André now. André, how do you see things from where you are?
Yeah, thank you, Michael. At ILGA World, as you heard from the introduction, we're this big federation of LGBTI organizations around the world. And since the COVID-19 pandemic started, we've just been receiving so much information from groups from the Pacific Islands through to Japan, mainland China, India, Serbia, Africa, of course, Latin America, and even in North America. This is an enormous situation. It is, I think we all know that. It's enormous for the whole world, and it's also enormous for queer people all around the world. We being LGBTIQ plus people, are facing challenges which are both unique to us and yet also just shared as, world neighbors with everybody else, as this pandemic knows no boundaries whatsoever. And I think one thing that we have seen, I'll just start out on this, is that we have also seen the resilience of our communities. So many queer people have had to just face our whole lives, struggles, difficulties in different ways, and we're showing resilience in many quite amazing ways. I'm just going to give a highlight to a few things that we're hearing from around the world. We have the health risks that people are facing. Some of the things we're seeing, trans and intersex persons are struggling to get hormone treatment as hospitals are closing down, pharmacies, people being deprioritized on some of their health issues. Those people who actually are contracting COVID-19 are in fear of actually going out to get treatment. We have in Uganda, we've been hearing from groups there have been saying that the services provided by the state already basically deny LGBTI people on a normal basis. People are fearful to go out and get any treatment. They don't want to be going into hospitals at this point in time. Not just health, we see huge amounts of loss of work and food insecurity all over the planet. We're seeing, of course, unemployment rates in the US rising, but that's not only in the US. We have huge numbers of LGBTI people are working in the service industry, and so many of these industries have shut down, whether it's the tourism industry, people working we have sex workers who are facing huge challenges as well. We're also seeing great moments of communities coming together and supporting each other in incredibly difficult times of loss of work. Even as people are getting humanitarian relief, we're seeing governments providing, providing food, providing handouts on aid, but we're actually seeing that there's discrimination against LGBTI people, even as that is happening. Sometimes what happens is that there's a definition that, the women should come out on this day and get the food and the men can come out another day. We're seeing that trans women, trans men, gender non-binary persons are being questioned on the street. We're seeing that in parts of Latin America. We also have situations where people feel if there are chaotic lines where people are lining up, people are being questioned as to their identity and their gender expression in those lines. We also have in the Philippines, we heard of situations where lesbian couples are turning up and saying, I'm here to collect food for my partner. And then when they're being inquired, like, well, who is your partner? And explain that it is a same-sex partner, that this isn't a legitimate relationship. You shouldn't be receiving any of this aid that we're handing out. So sadly, we're also seeing an increase in violence in the home. A lot of people have been forced into shutdown and quarantining in their local situations. We've seen trans women being forced to wear male clothing and have their hair cut in masculine ways. while they're living with their family. It's the only place that they have to go. We saw one woman in the Caribbean whose mother said that if she didn't dress like that, she would be thrown out, and then she was scared that she would then be arrested and sent to jail. We had heard from in China a bisexual woman who was telling LGBTI groups that her having to go home, she was going to have to come out to her family in the way that she hadn't had to before. And so we're seeing people forced into very difficult places, and she feels like she's under a lot of psychological stress, psychological violence, in fact, from her family. And I could go on with more cases about this. I think what we're also worried about is the measures that governments are taking around the world can be deeply oppressive and invasive. It's a use of the state is using power, but is using power in ways that can oppress all people, and actually queer people as well. We see particularly totalitarian regimes, which are using like an authoritarian control to come in and say, okay, this is a moment when we need to have deep control. And that in liberal democracies, they struggle in moments of this crisis, but actually places which have more authoritarian regimes are getting things done quicker. And the voice of democracy is actually shouting is not having a loud enough voice. So we're seeing some oppressive rules pushed through. We've seen in Hungary a law passed against trans people that was, should just be put on pause while these issues are going on, but in fact is being pushed through by governments. And in my own country of South Africa, I mean, we're just seeing the use of the force. We're seeing the army is out in the townships. We're seeing a hyper-militarized police is forcing people to stay at home. And queer people, we're the ones who actually end up getting targeted so often when we're on the streets. We stand out often, particularly people who are whose gender expression is more diverse, then they'll be targeted by the police. I think essentially as well in the humanitarian crisis, we've seen a deprioritization of anything LGBTI. Governments are saying, listen, we'll deal with the pandemic first, and then any ideas of inclusion we'll get to later, which of course is just devastating for so many of us. Because that's not how it should be operating, that we can't just park our sexuality, our gender identity, our gender expression, our sex characteristics, we can't park these at the side. This is actually the very way that we should be receiving relief. We should be receiving treatment of our friends and fellow citizens. That needs to happen in all times. But if we just see that as soon as something difficult rises, the response of governments is like, no, this can wait. I could talk about social isolation and anxiety. I could talk about the homelessness of youth that we're seeing throughout all of this, but I think I'm out of time for the moment. I can come back to some stuff later. Thank you, and back to you, Michael.
Thank you. Thank you, Andre. Thank you for that picture, a rather disturbing picture of the experiences of people around the world and the kind of violence and challenges that many people are facing just to get basic necessities or have the right to have the access to healthcare and treatment, nutrition, other things that are so critical to life. But also thank you for your vision of justice that you share with us in the way you talk about these things and the ways in which we can be encouraging governments to act in a more just way. It's so important. Thank you for that. And now I'm going to turn to Rhina, and we're going to get the perspective that Rhina will share with us.
Hi, everyone. It's great to be at this panel and highlighting very important work in highlighting communities that are often being beat up, forgotten, and just put to the side. And you have heard the numbers, you have heard the international picture of what that looks like, the marginalization, and I can talk to you about the local work. My congregation, which primarily is formed by Latinx immigrants, LGBTQI+, one of the first things that started happening as soon as the stay in place orders happened in the Bay Area is that people lost their jobs, and those who are asylum seekers who have not yet gotten an authorization to work legally in the US, those were even more at the risk of losing housing, sponsorship, the limited resources coming their ways also got shortened. And so as a ministry that is small but mighty, we collected donations to make sure we were providing for basic things like food and shelter and transportation and whatever was necessary for people to keep afloat. And we were able to mobilize resources, and I was getting calls for the first 2-3 weeks of the pandemic, or mostly of the times we were asked to remain at home. I was getting a call every day from somebody who had been told our ministry worked with the LGBTQI community and we could help. And so we did. But it has required so much creativity, not just to funnel resources for us to funnel the resources out, but for us to find ways of getting support to people, because I cannot go out and visit people where they are, because I'll be exposing them and I'll be exposing me and I'll be exposing my spouse. So I have had to find ways on how to get the money to them through cash apps, through mailing the checks, to finding ways in which the money is going to get to them, because we want to stay safe. And then the other thing that's been happening is that it's a stress on pastoral care, because how many LGBTQ queer Spanish-speaking pastors who are embracing of that community are out there? Not many of us. And so to provide counseling and care in Spanish, you find yourself as being the person that, you're gonna have to, there's gonna be a stress and it's been hard. It's been very hard because people are suffering, and I have had to pray with a lot of people on the phone. And at the same time, my family got affected by coronavirus. My dear aunt, who is like a mother to me, got the coronavirus 5 weeks ago and has been fighting for her life. So there were moments when I had it to be a pastor where I needed it to be pastor too. And so that's another important thing that I really want to bring to this pastoral care in times of the pandemic for LGBTQ folks, is that us who are tending to the needs of the community tend to be just a few of us, and then we too are human. And so one of the things I did was to have a network of pastors that will pastor me, so that I could continue pastor others, because there was no way I was going to be able to do the work I was doing locally effectively and stay present and stay faithful, because I'm too had a broken heart. So that's what I'm seeing from the corner of the world where I'm at. And I just feel that it's very important to highlight that as government continues to take away the few rights, the few resources that are there for our community, it's going to be key and important to support and uplift the leadership of many community leaders that might not be ordained yet, but who have the ability to be serving in our churches. And we need to find ways to bring them into those places of leadership, because I just know we need more hands. And this is one of the times where I don't know the quote in English, but it's that verse of la mies es mucha y los obreros son pocos. So the harvest is so big, and those who can farm, are just a few. These are the times. The harvest is immense. And so we're going to have to, our denominations have to get creative, because you know what? After the pandemic is over, Pentecostal churches are going to grow. Those that are conservative are going to grow because people are very afraid, and they're going to tap into that fear. They're going to tap into the fear. So I want to see us at the forefront of getting those people into our churches to learn progressive theology that is not discriminatory against the LGBTQ community. Because after this is over, we are going to be scapegoats of what went wrong. Because this is going to come as the condemnation disease, because, you know, the US have forgotten about God because it's marrying the gays. So let's be alert. Let's be on top of this. Let's go out there and start being evangelists for the good of our communities.
Thank you, Rhina. You not only have given us a perspective of what it's like to be on the ground in the local situation and tend to the needs of people that you encounter, but you are a preacher and have inspired us with the importance of sharing the message of the gospel. And that's one of the things that Jesus did with his disciples, isn't it? He sent them out to preach and teach as well as to heal. So thank you for that. I want to encourage folks to begin placing your questions in the Q&A box. We'll get to as many of those as we can. And I see we have a question already for Carmarion and from Carlos in Puerto Vallarta. So what advice can you give us to go out and tell people about us, that's LGBTQ plus people, in order to reduce ignorance and prejudice? What is your experience on being brave and intelligent about this?
Thank you, Michael. Carlos, thank you. What an awesome question. You know, Q&A usually give me anxiety because it's like, okay, am I the right person? Because we speak from single narratives that will support also through our social networks and our communities. What I can share though is that I think that partnering and finding those allies, and not just individuals, but those institutions that do the work towards inclusion, towards equality work, and jump on the bandwagon and what they're doing. My fear always is that although we as trans-identifying Gen Z people could be very motivated to go out and be on the front line, but it also puts us in harm's way if we're not quite prepared. And so sometime by partnering and collaborating with infrastructure such as institutions or other social groups that are trans-led, where there's more numbers, not only does it allow y'all to come together with a mighty force, but it also protects you as you're doing the work. Force, you know, brave and intelligence and things like that, you know, just for me to speak very just blunt to my community, important of showing up to be counted is not always showing up to always share your voice or your narrative or to also be tokenized. It does allow you to show up so you can learn the atmosphere, so we can be prepared to know how to respond in a way where we will not be second guessed. And so bravery and being courageous does come from a place knowing that you have the assurance that you can go there. Not everywhere do I go still, you know, and I don't mind. My personal journey is June will be 24 years. I was a teenager when I transitioned, and I still at this juncture, I'm very wise of where I go. And if I do go, I make sure that I understand the atmosphere that I'm going. I bring someone with me. Then once, you know, I am there and I'm able to assess the atmosphere, that's actually where the courageous braveness come in, because I just mastered something of showing up and no longer in fear of being there. And then I continue to duplicate what I did in order to get into that space. And so for any of my trans identified, and it's going to look different regionally and jurisdictionally and continent wise, but we do have the power with our voice to make a difference. Is how and when we are able to use that power. But the most important thing is going to be our safety and how we show up being visible. The final thing I'll say about that is this is to my allies. Showing positive visibility of the trans identifying Gen Z community is a great learning tool. It's like media. If you give us the positive of who we are, it will reduce the stereotypes of the negative that people have about us.
Thank you. Thank you, Carmarion. I was looking through the ILGA newsletter the other day, and I came across a link to an article about a New Jersey legislator, Valerie Huddle, who said that data should be collected on sexual orientation of coronavirus patients. Data should be collected on the sexual orientation of coronavirus patients. What do you think about that? Is she right? What do you think, André?
Well, thanks for the easy question, Michael. You know what? When I sit down with governments around the world and we try to see how can we make sure that we are better protected, because we are ignored and left out time and time again. We've been invisibilized as people forever. It's only recently we've started to pop our head above the water and say, please, I'm here, I'm queer, like count me. And so there is a tremendous need for us to somehow appear in data, for us to appear in statistics so that we can be measured, and the statistical level of our exclusion can actually make it onto graphs and charts, and we can go to legislators and say, look, it's not just a bunch of people being emotional saying we're left behind. It is measurable that we are being left behind. And then in the very same breath, I get absolutely paranoid about putting into the hands of legislators who days, weeks, months ago were ready to imprison us, criminalize us, exclude us, deny our rights. Why would I be advocating to be pushing all that data into the hands of governments who will then probably end up using that against me? It's like, why do we have gender markers on our documents? At the end of the day, when governments have information about a man or a woman or another, it has been time and time again used to exclude and deny people the rights rather than actually just to be used as an equal measure. So you asked what my opinion is. I actually struggle to this day with those two measures. And I go to governments and I say, I struggle with those two measures. Please count us, but being very, very cautious. And we have to make sure that the way we collect data therefore protects people. But I think that's part of an ongoing discussion.
Yep, I think you're right about that. The other thing I'm curious about, because you raise the important ways in which people can be visible, and I think that when we think about doing pastoral care with folks or trying to express welcome to people, which in and of itself can be a pastoral act, I'm wondering about what are some of the other ways in which pastors can offer pastoral care, particularly in this particular time when people are physical distancing and not being able to be present to each other in person. What can communities of faith do? And Rhina, you mentioned some of this in some of your comments, and maybe you could say a little bit more, and I'll open this up to some of the other panelists too. And I'll remind our community who's here to please put your questions in the Q&A box.
Sure. So we went online with our activities very early on in March, and that has provided an amazing opportunity to reach other people who couldn't otherwise be in Oakland, California. And they are connecting via Zoom, Facebook Live, and we tend to attract a younger generation of LGBTQ Latinos. So they are technologically savvy. And they often have been rejected by their home churches when they came out. And so here we are, being a church to them. So definitely connecting through these virtual environments is not something new to some of the people that are coming to our services online. But one thing I thought about it is that just having another service online wasn't going to cut it for the community that we serve. So we started integrating other aspects of our culture, and we're going to have a concert on Friday, and that's going to be the main point of our getting together. We had a Latin mixed dance class a Saturday ago, and so we are trying to make it so that the engagement, that other parts of our spirituality connect us, and not just the talking of a verse or the sermon or the prayer. So I find those ways important for people who don't connect through those virtual platforms. A phone call has been the way to connect with them, and it has worked fine. As long as they know how to find us and we're reaching out. Often have immigration attorneys referring people they're working with who are asylum seekers because of their orientation or sexual expression. And so if the person is struggling with issues of faith and want a pastor to call them, I get their numbers, I call them. So there is always ways to connect, and the connection will be as real as you are, as any of us are out there, putting ourselves out there. And one of the things that we have produced at the national level that I want to point out, and it's probably going to go on the email afterwards, is that for those congregations that don't know yet where to start, opening themselves up to welcoming the queer, the LGBTQI plus community, we have some toolkits, and if it can be shown, the link on the screen now, but if not, I don't have it handy I cannot share with you, but it'd be sent to you. And those toolkits, what they are very basic conversation on how to start a conversation at your congregation about the struggle of a person of faith with their sexual orientation or their sexual expression, how they went about understanding their Christianity and also who they are and living authentically in the world, and how to pose questions to your congregation about it. And those toolkits are both in English and in Spanish. And we also have one about basic conversations and racism. And these aren't for people to dismantle white privilege all at once, because we know that that takes a lifetime, but at least to get the ball rolling. So I invite you to visit the UCC.org website, Proyecto, Encuentros, Gracia, y Bienvenida, and you can download the toolkits there. But those are tools that will provide you a starting point.
Michael, if I can just chime in, and mine will be very quick. This is going to sound very elementary, but when we speak about pastoral care and when we speak about during this COVID and pandemic season, I think for me, and this is more from working in Southern churches, from a minority culture, is that the importance of pastoral care is also sharing the message of what we should be doing. So we should not be going against the grain, obey the order of the land. You know, so if we are supposed to be experiencing and incorporating social distancing, then we should be in position to support what is going to keep our congregational safe. And so we have to partner with our, with the municipalities and the government officials and the legislators and all of those that are making decisions to make sure that we're staying safe and not go against the grain. Care to me is that I have a message to ensure that you are being safe. And I understand that, we're not used to this, but this is what's going to reduce COVID, so it will not infiltrate here in our congregation, to our families, and to our surroundings. And so pastoral care to me is the first thing, is to make sure we're saying the right message in support of their safety during COVID-19.
Yes, thank you, Carmarion. That's insightful. I appreciate that. So, André, we have a question in the chat, and might ask you to make a few comments about this, and that is not in the chat, but in the Q&A box, from Francis Bernardo, who's from New Ways Ministries in DC, who asked, some commentators about the virus sometimes say that we have a chance to start a new, more just society after the pandemic. Some commentators say that reopening society will be painful and cause more damage than the world has already experienced. So do the panelists have any thoughts about what might be possible or not for LGBTQ equality in the future?
Wow, what a question. Thank you, Francis, for that question. I was struck actually by what Rhina was saying earlier about these apocalyptic predictions that some churches might be making in the future. I hate to tell you, it's already happening. I'm sure some of you have been looking on the news in the last 24 hours. Even in South Korea, we're seeing evangelical churches are now behind some of the investigation into groups in Seoul, which were for the new COVID outbreak that's happening there. We've seen in Zimbabwe, we've seen in parts of Latin America, we've seen many places churches are suddenly preaching this whole LGBTI people are causing the pandemic. The apocalypse, I was actually struck in my church on Sunday was a sermon about the apocalypse, that the apocalypse is actually basically a great unveiling. We tend to think of it as a big disaster moment in a Hollywood scenario with nuclear bombs going off, but actually apocalypse is actually the great revealing of things that could not be seen until this moment. So if we're able to somehow take this moment, this great moment of unseen stuff, which is now all coming to the surface, I actually wonder if that is the moment of how this planet and LGBTIQ people as part of this planet are able to be part of that solution to say, that's right, in this moment, all this litany of pain and trauma that we are seeing was in existence before, but it is brought to the surface now. Governments have always been abusive. Trans people have always been denied healthcare. People don't have work in many places. Nobody has access to the appropriate healthcare they should. And we have such injustice in the society. So that is the moment that I believe we can be hopeful on. And that is the moment in which I think, please, pastoral care means, yes, it means caring for people in their individual moments. But as Carmarion has said, I mean, it's also about telling people what they can do and how we can rise up as people of faith. So I think that that is what I hope for, and that is what I pray for in these moments. Thanks.
André, I believe that was a great response. And you kept talking about unseen. And I want to flip and say what I see is yes, you know, LGBTQ people have been discriminated. We have been segregated, isolated. We haven't even spoke about the trauma that we're receiving out of this isolation. But what I can tell you is what are we doing? Because COVID has proven to us and shown us that it doesn't discriminate. And what type of message can we take from that this pandemic who came in wasn't worrying about if we were lesbian, gay, bisexual, transgender, queer, and everything, heterosexual. It didn't care about our race. It didn't care about anything. And we are dying as a society. So what can we do to bring all of us together to combat COVID? And I believe that some of the tools that we need is we need to come together, put our differences aside, quickly become educated, get a book for dummies, whatever you want to, to do. But we got to combat COVID, because COVID is not concerned about discrimination. COVID is just killing us. But what we're doing is we're still isolating certain groups, and we are becoming the other COVID of the virus that's keeping the pandemic ongoing. That's my concern of what the future may look like, is that we may tangibly get rid of this COVID virus and have a virus, but we'll never get rid of the negative viruses that penetrates us as LGBTQ communities and other vulnerable communities. And that's what we need to be speaking of. And I guarantee you the same antidote that is going to kill the coronavirus can be that same antidote spiritually that will be able to also kill these discrimination, homophobia, transphobia, and everything that doesn't allow us to come together as one nation in love.
So a basic rule of community organizing is that you organize around self-interest, and you organize people who hold the same common self-interest, and it's just basic. You come together because something is, you're gonna fight together against something. And I think what this pandemic has created for Black community, brown community, the LGBT community that holds both of their identities, many may intersect, is that opportunity to come together, because big foundations, they don't give grants to trans community. So what I seen the community do is to come together to put everything together to highlight these injustices and bring funds that are now going to be distributed among people who have been in the front lines of discrimination. And I was looking at a group of you people in the Bay Area put together a dance party online and a drag show that they raised over $10,000 to give to the trans community. And it's just like these times just propel us to do the work we do together even more urgently, and to just go for it. And we are going to come out of this as an organized community.
Yes. Well, thank you, Rhina, and all of the panelists. It's time for us to wrap up our webinar for today. I think the information we've had has really helped us to move and has helped to understand the context of the International Day Against Homophobia, Transphobia, and Biphobia. In that, here we have the opportunity to be in solidarity in the midst of this pandemic, to work in areas in which people experience stigma and discrimination and are marginalized in their communities and experience violence. I'm going to give you one word, each person, so you can't tell a story because we're running close to time. And that is to follow up with what Carmarion said about what she sees. And I'd like you to say one word or phrase about hope. Where do you see hope? One thing, each person. André?
Neighborliness, solidarity, global citizenship. That's my vision.
Rhina?
We are such a vibrant, colorful community that our colors have to show. We are visible.
Carmarion? Oops, you're on mute.
One accord, united, but ultimately resurrection.
And I think for me, it's the hope is around where we really live out this value, where every person as a child of God has worth and dignity that human judgment can't set aside. When we live that value out, there's hope. And now I'm going to turn it back over to Chris.
Thank you so much, Mike, and to all of the panelists. Thank you for bringing your lived wisdom, your experience, and everything that you have and everything that you are, which is created by God, into this space. On behalf of JLCM and the United Church of Christ, for all who are watching this now or in the recording, I want you to hear that siblings and sisters and brothers, you are beloved. You are created in the divine image of God, and you are worthy of love and affection. So thank you for being with us. If you are inspired by this webinar and into what is coming, you can financially donate towards what we're doing by texting UCC to 41444 to support programs like this. And know that the next thing upcoming is on Thursday, same time, same place, and we're talking about the digital table and communion in theological ways, in ways in which we all may partake, whether it's what's in front of us or by intention and energetic connection in communion in the United Church of Christ and beyond. So thank you. And as we close up the webinar, I'm going to invite Reverend Mike Schudemeyer to pray us into the world that we have not yet capacity to know, but must imagine.
So let this be a prayer of sending. So may we as people of God provide opportunities so that the voices of people with lived experience can be heard, that there's nothing about us without us. And may we weave the experiences of our LGBTQ members into our preaching in topics of justice and charity and the universality of God's love. And may we provide educational programs and liturgies and ways in which young people can be involved in topics about them, especially LGBTQ plus topics about LGBT youth. And may we teach about the subtle and often non-physical forms of violence, the emotional violence, the rage, the degrading, the shaming, the denigrating, and the spiritual violence that some feel they may be excluded from salvation. And may we also finally teach clearly that violence is never an appropriate response to people who are simply different. Bless us, God, as we go from this place, and may we live a vision of a just world for all. May God's peace go with you. Amen.